So our CS and guests, all guests that have come, today marks a truly momentous occasion in the history of our beloved nation. We stand here united to witness the official launch of the national policy on prevention, management, and control of alcohol, drugs, and substance abuse in Kenya. This is not just, it is a profound declaration of our collective resolve to confront with unwavering determination one of the most insidious threats to our societal fabric, our economic prosperity, and the very future of our children. For too long, the shadows of alcohol, drug, and substance abuse have cast a long and dark wall over our communities. We have seen firsthand the devastating consequences: shattered families, lost livelihoods, compromised health, rising crime, and stolen youth. The statistics, grim as they are, tell only part of the story. The true cost is measured in the silent suffering, the unfulfilled dreams, and the erosion of hope. As the chairman of NACADA board, I stand before you today filled with hope. This is because the policy we are launching today possesses a robust, comprehensive, and scientifically informed roadmap to navigate the challenge of alcohol and drug abuse. The policy is a culmination of extensive consultation, rigorous research, and dedicated collaboration among countless stakeholders. It embodies the voices of our communities, the insights of our experts, and the commitment of our government. It represents a paradigm shift from the fragmented interventions to a holistic, multi-sectoral, and balanced approach. First, it places prevention and demand reduction at the very core of our strategy. We recognize the place of prevention, which is better than cure. The policy champions intensified public education and awareness campaigns tailored to reach every corner of our nation, from the bustling cities to the remotest villages. We will empower our children and youth with the knowledge and resilience to resist peer pressure and make informed choices. We will work tirelessly to address the socio-economic vulnerabilities that often push individuals towards substance abuse. Secondly, it reinforces our commitment to strengthening law enforcement and supply suppression. Illicit drugs and unregulated alcohol are poisons that must be eradicated from our society. This policy provides a clear framework for interagency coordination, intelligence sharing, and stricter enforcement of existing laws to dismantle the networks of producers, traffickers, and peddlers who profit from human suffering. We are sending a clear message. There will be no sanctuary for those who endanger our people. Third, this policy elevates the importance of treatment, rehabilitation, and social reintegration. We understand that addiction is a disease, and those afflicted deserve compassion, professional care, and a pathway to recovery. The policy outlines strategies to expand access to quality treatment services, establish more rehabilitation centers, and ensure robust aftercare support to help individuals successfully reintegrate into their families and communities. Our goal is not just to treat, but to restore dignity and purpose. Further, this policy emphasizes research, monitoring, and evaluation. We are committed to an evidence-based approach. NACADA will continue to serve as the center of repository for data, conducting and commissioning research for better understanding emerging trends, measure the effectiveness of our interventions, and adapt our strategies accordingly. This will ensure that our efforts are always agile, effective, and responsive to the evolving landscape of substance abuse. Ladies and gentlemen, to achieve the ambitious goals set forth in the policy, collaboration will be our cornerstone. This is not a task for NACADA alone, nor for any single ministry. It requires the active participation of all government MDS, county governments, the private sector, civil-based institutions, and most importantly, every Kenyan household. Each one of us has a role to play in building a drug-free society. As we launch this policy, I urge everyone present, and indeed all Kenyans, to embrace its tenets and become active champions in this vital campaign. Let us leverage the power of our communities, our cultural values, and our collective will to protect our present and secure future. On behalf of NACADA Board of Directors and the entire team, I extend my deepest gratitude to His Excellency the President, Honorable William Samoei Ruto, for his unwavering support for the prioritizing this critical national agenda. We are immensely grateful for the trust placed on us. Much appreciation to our chief guest and the cabinet secretary for pushing this document particularly and leading us in the fight against drug and alcohol abuse in the country. We greatly appreciate you, sir. Today, we take a monumental step forward. Let this policy be a living document, a guiding light that illuminates our path towards a healthier, safer, and more prosperous Kenya. Let us work together hand in hand to free our nation from the chains of substance abuse and unleash the full potential for every Kenyan. Asanteni sana na Mungu awabariki. Ladies and gentlemen, it's now my pleasure to invite our chief guest. But before, as he comes, I want to say, Waziri, since you took over this docket, I want to greatly appreciate you on behalf of the board. We've felt the support from your office, and you've helped us lead the fight so well. So as NACADA, we are very proud of you. And I'm sure every family in Kenya that is suffering, when they see you seated here from alcohol and drug abuse challenges, they have a lot of hope, and they are very grateful.